Hi again, it's Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing 5 new presumptive cases of COVID-19, which means that we have a total of 9 presumptive cases and 3 confirmed cases. All told, that's 12 cases. We know that these 5 new cases were either all travel-related or connected to an earlier case, and an active public health follow-up of those cases to identify any close contacts is underway. We know that in total of all our 12 cases, the age ranges from their early 30s to their mid-70s. In communities are spread out across the province, and all of those cases are in self-isolation and recovering at home. We fully expect, and the Nova Scotians need to fully understand, that we're going to get more cases, likely to increase, especially as we get people returning traveling after March break, and we have to be prepared that we're going to start to get some community spread in some of our cases as well. That's why it's really important. I want to build on a little bit on the importance of social distancing and self-isolation, and I'd like to take just a few minutes to explain that. So all of us need to be practicing the term you've likely heard is social distancing. What that really means is we need to try to physically distance ourselves from others as much as possible, and that means within that trying to keep at least 6 feet apart from other people as much as possible, because that really helps limit the direct spread from person to person. It's why we're closing down large mass gatherings. Many businesses are being shut down to help limit that physical space between people. It's why we're saying people need to be spend much more time at home. But when we say social distancing, it doesn't mean you can't be out and about going. It's a perfect time to be more active. Go for a walk in the park. Go for a bike ride. Physical distancing doesn't mean you can't be out and about at all. It means trying to separate yourself and not have close contact with numbers of people. So we all need to be doing that. So while we're physically distancing, I would encourage people to increase their social connectedness. Many of us have more time to do things now. Let's use that time to get more connected, to support each other in our communities, just by picking up the phone or one of our devices, even within our families, to spend more time just connecting with each other. So even though we call it social distancing, it's really physical distancing, and we're encouraging people to actually increase their social connectedness. The next step above that is for anybody who's traveled outside of the country in the last 14 days, they need to self-isolate. It's the same principles. It's removing yourself and minimizing your contact with other people. It doesn't mean you absolutely have to stay 24/7 inside your home. And I think this is what's leading to some of the confusion, where people are saying, well, I think my neighbor there traveled and they should be self-isolating, but I saw them out walking their dog or they're in their backyard. It's perfectly okay if you're on self-isolation from traveling to be, if you have to do essential errands, going to get your groceries or whatever, that's okay. If possible, get somebody else to do it. But if you can't, and it's okay to do that. It's okay to be out and about, working in your yard or going for a walk. The next layer above that is then if we know somebody is a contact of a case, we also say that those people need to self-isolate, but it's a more rigorous self-isolation. So they need to more actively limit their contact with anybody. And if at all possible, they should not be going, they can go outside on their own, but they shouldn't be going out, if at all possible, getting groceries and where they might come in spaces with other people. And then the last layer is cases, whether it's somebody who's symptomatic and is either waiting for a test result or is tested positive, they need to be on very strict self-isolation at home. They're sick. They should be trying to separate themselves as much as possible from people that are other people even in that home. If at all possible, have their own bedroom with a separate bathroom, avoiding close face-to-face contact with somebody within that home. So it's that layered approach from everybody's distancing ourselves from each other, to self-isolation all the way up to very strict isolation if somebody is actually sick with COVID-19.